Hello, everybody. This week we decided to try this brand new thing called video. Yeah, video. Now, in order to look good, I got myself a new haircut, and I also figured out how to turn the video button on my iPhone. So, congratulations are in order here. Now, in all seriousness, what I wanted to talk today is the concept of precision medicine. Now, figuring out a patient problem is always an interplay between very fine details and the big picture. In other words, we always have to zoom in and also zoom out on a set of data points in order to figure out the problem, in order to put some order in the initial chaos of the initial patient presentation. So precision medicine works on two fundamental levels. First level is when we try to figure out precisely the body part or body parts that are responsible for patient's pain or problem. For example, patient comes in with low back pain that radiates into the buttock area, maybe into the groin and the hip and the anterior thigh. So is this a spinal problem? Is this something that maybe comes from the pelvis, maybe a hip issue, maybe even an internal organ problem? The answer requires not only a good history and physical examination, but also correct interpretation of all radiological studies, and in most cases, a series of precise diagnostic procedure that help us figure out exactly the body part or body parts that are dysfunctional. Now, this part may sound simple, and it may be simple, but it's not easy to do. It requires paying attention to a series of small little details that all contribute to the correct answer. Once the first part is done and the anatomical structures are figured out, we zoom out once and we start looking at functional movement patterns, activity levels, types of activity, kinetic chain, etc. Once that is figured out, we zoom out again and we look at the whole patient's health by determining different sets of biomarkers that help us look at, for instance, somebody's inflammatory state, their metabolic health, their possible hormonal dysfunction, and so on. Microscopic and macroscopic factors usually spread over multiple body systems. Now, this is not simple and it's not easy to do. So what we're trying to do here at Precision Medicine is to face this challenge head on. We do this in an individualized, customized way for each one of our patients. Obviously, it requires a team approach, and I am grateful and thankful to our team and our staff for helping us figure out these very complex problems. Hopefully this clarifies, at least briefly, what we're trying to do and what precision medicine is and is not. In future blogs and videos, we will tackle simple subjects and we will aim to clear up some misconceptions about these subjects. Thanks for watching, and let me see if I can figure out how to turn this thing off now. Thank you.